Welcome, everyone, and thank you for attending. Questions can be asked using the Q&A pane in your WebEx event control panel. Today's presentation will be recorded. If you have any objection, you may disconnect at this time. The recording will be available on demand. I will now turn the presentation over to Henry. You may begin.
Thank you very much, Kelly. Good afternoon. SHRM, Long Island. It is nice to talk to an audience of voices that cannot respond to me, as always. So I know all my jokes will land. I know everything I say will be well received. For most of you, if not all of you, I assume you are doing this webinar from home, so your dedication and passion to your craft is respected and understood. I've spoke to those of you who went to the SHRM Breakfast Series, Long Island Breakfast Series back in January. You heard from me. I helped Ian Bogatti present there. I think I presented to the East End Breakfast Series in February. I presented with Craig and Jeff Schlossberg last month, this month. So you've been getting a fill of me. So I apologize for those of you that don't like me. I know there's probably many. But I hope to give you in a weird way, another obligation under New York State law that is going to make your lives a little bit more difficult, because that's usually what I do. But will hopefully be a pleasant reprieve from coronavirus, COVID-19, the Families First Coronavirus Response Act, quarantine, isolation. What other buzzwords can we throw in there? Stimulus bill, unemployment. So hopefully we can take 20 whopping minutes and not have to worry about those words for now. To anybody who is under the weather, family, loved one under the weather, I do wish them the best of health. I hope that there's brighter days ahead. I've heard a lot of, my wife is a registered nurse at Huntington Hospital. I've heard a lot of good stories as the days pass, patients being discharged, patients recovering. So there is hope abound as hopefully the weather gets nicer. Hopefully we'll be able to have a positive theme. And, while we remember everybody who is unfortunately struggling with this, hopefully we can get to a place where some sense of normalcy will return. And when you go and dial into these webinars, what do we consider normal? More obligations for you. So first, before we even get into this paid sick leave law, what I do want to add, in the midst of all of this, and you might have heard from your counsel, from us already about this. If not, I'll tell you now. Suffolk County has passed a ban the box law. We don't have an effective date yet, but it's going to be coming. Ban the box, for those of you that don't operate in New York City or just don't know what it is. Ban the box is a movement to take questions about criminal background history off of employment applications and to prevent employers from finding out anything about an employee or an applicant, I should say, an applicant's criminal background prior to extending a conditional offer of employment. This has been the law in New York City since, I believe, October of 2015. If you had to quote me, I think it's October 27th, but I could be wrong. October of 2015, New York City prevented any questions on an application and a job posting and an advertisement anywhere, verbal, written, anything about an applicant's criminal background. It's also the law across the country in different localities. The law in Buffalo is the law in Rochester. It is not the law in Nassau County. It is not the law in Westchester. It is not the law in Suffolk right now. It is coming to Suffolk. So what does this mean, employers? Now's a good time to look at your applications, to look at your job postings, Indeed, LinkedIn, Want Ads, whatever you still use, Google. Make sure these things are cleaned up. We don't want to be mentioning anything about criminal background. I don't have much in the way of new information or new procedures on which you should start to take, other than taking a look at these items, your applications primarily. And probably this is something where we should consider training those who do our interviewing. Beyond that, we're going to wait for more about this law to come out, but it's just something to have on the horizon. There'll probably be a 4-month turnaround for when it becomes enacted. There's usually a 120-day period. That's the 4 months. So something to keep in mind. Keep an eye out. Suffolk County ban the box, targeted at giving those with criminal backgrounds a second chance, so to speak, where they are not questioned prior to prior to receiving a job offer. Again, the point is you want to consider people's qualifications, skills, and abilities to do a position, not just because they might have had been convicted of a crime 25 years ago that the state, and largely New York City, would say is irrelevant to whether or not they could do the job now. So, Suffolk County banned the box to decide. What are we going to talk about today? So, New York State paid sick leave. Let me be very clear. This is not what the COVID-19 quarantine leave or COVID-19 paid sick leave is. This is not the Families First Coronavirus Response Act. That's a federal law. This is not extended or expanded FMLA, federal law. This is not the emergency paid sick leave under the federal law. This is a state law that has nothing to do with COVID-19 right now. This law does not take effect right now. You do not have to do anything right now, today, for this law. There are proactive measures that I'm going to recommend that you do, but right now, this is nothing that you need to ruin your weekend over and go reviewing all your handbooks. So while the interesting thing about all of this is if COVID-19 wasn't occurring, this would be PSL worthy. This would be a major change in the law. It is a major change in the law for New York State employers because it affects everybody. And any time a law affects everybody, you know it's a big one. And it requires pay. It requires more money. Now it's going to be in the form of sick time, paid sick benefits. But this is something that you would have seen 8,000 articles. We would have told you about it at 3 different breakfast series. I would have done this webinar 2 different times. But because unfortunately we've all been consumed by COVID-19, it is well on the back burner because it has not been the highlight of every Governor Cuomo press conference. It's something that came out in the budget and he signed, and here we are. Now we have it. So if anybody's wondering where this came from, it was a budget bill. What is it? So it's mandatory paid sick leave. As everybody here knows, if you're operating in Nassau or Suffolk right now, which is where the focus of my discussion is, there is no requirement to give paid time off. There's no vacation requirement. There's no personal time requirement. There is no paid holiday requirement. There is no paid sick leave requirement. Those don't exist. New York City has paid sick leave. Westchester has paid sick leave. Other localities across this country have paid sick leave provisions, paid safe leave provisions, which are really targeted towards domestic violence. But there is no requirement to provide this paid time off, so to speak. There's other things. There's leaves. There's PSL, which we all know. That was kind of what started this whole trend. But paid sick leave it's got nothing to do with paid family leave. As we all know, paid family leave does not apply to an employee's own condition, minus this little COVID-19 expansion, but traditional paid family leave does not apply to an employee's own condition. Paid sick leave will. So now New York State is giving employees an avenue. If an employer doesn't provide paid sick time, they're giving these employees an avenue to possibly get pay for when they're out sick. So who does it apply to? Everybody. Everybody on this call. There's a question as to whether or not it's going to be paid. That's going to depend on the size of your company or how many employees you have, which I'll cover, I think, on the next slide or two. But every employer in New York State has to comply with this law. So normally, if you've been tuning into me for the last, I think at this point, 3 some odd years, if you've been tuning into me, you would hear me tell you what New York City does usually will find its way out to the island. You know, things tend to, gravitate by osmosis, with Nassau usually being the last. Suffolk usually comes first. Well, remember New York City had a salary history ban. What did Suffolk County do in the middle of last year? Salary history ban. New York City has banned the box. What did I just tell you earlier today that Suffolk County did? Ban the box. New York City has mandatory sick time as of May 2014. Now look what New York State is doing. So it's always a little bit different, but the city usually sets the trend, and then other localities, whether it be Westchester, Nassau, Suffolk, etc., follow. Westchester followed with the paid sick leave. I believe it was either early 2019 or mid 2018. I don't quote me on that one, but this is not unusual. Now, what dates do you need to be mindful of? The law really starts on September 30th. Why? Of this year. Why? Because that's when accruals can start. That's when employees can begin accruing time under the law, because it's 180 days after Cuomo signed the budget. So September 30th is really when this, kicks in, because that's when you're going to, if you don't already provide paid sick time, that's when you're going to have to start tracking the accruals that you do provide, and making sure you give employees their entitlement under the law. However, the usage of paid sick leave does not start until January 1, 2021. So people can accrue time based on how much they work, which you'll see in a second, starting on September 30th. However, what they can't do is they can't use that time. Now, none of this changes your typical policies. None of this changes if you already have paid sick leave, unless you go and amend your policies and give notice to your employees. None of this will change. Employees can still use paid sick leave if you offer that as an employer benefit at the end of this year. That's irrelevant from the law, and there's nothing right now that says you can use that paid sick time as a credit, because again, you cannot allow usage of this law until January 1, 2021. So if you're going to say, oh, I let people use 5 days of paid sick leave at the end of 2020, that should be, now they have less time in 2021. No, that's not how the law is written. There's no guidance yet. So I'm reading to you or trying to educate you, which I know is sometimes difficult for me, because not everything I say always makes sense, because I talk to you about laws as soon as they come out. So it's very difficult to sometimes analyze things when we just don't have enough information. But here, there's no guidance, there's no regulations yet. They're expected to come, but we don't have them yet. And I probably have said that to you more than anything. Once they come, I'm sure we'll have much more information. But right now, I think we can all agree this is not the focus of what's going on in Albany right now. Healthcare and turning the economy around from COVID-19 is the focus. So this slide looks like a lot of writing. I bolded what you really need to know, the amount of leave that an employer is going to have to give. So if you are an employer with fewer than 100 employees, and it doesn't define the location. So if you have 100 employees statewide or 100 employees nationwide, it doesn't. There's no distinction here as far as where you're supposed to count your employees from. So we have to assume conservatively it means your entire company, even if not all those employees are in New York until we get more information. But again, this benefit would only apply to those in New York. So there's a hope that they'll eventually just say you count your New York employees. And then there will always be questions about what about those that remote work? What about those who live in a different state? The same questions that we always have. I don't have answers to those yet. The guidance is now yet. Traditionally, the guidance will answer most of these questions, not all. And then those questions that it doesn't answer will be the ones that we spend the next couple of years guessing on what the answer is and hoping to do the right thing. So if you are fewer than 100 employees, you have to get 40 hours of sick leave. However, and that has to be paid unless you have fewer than 5 employees, which ironically that's the New York City threshold, 5 employees, unless you have fewer than 5 employees and a net income of less than $1 million in the previous tax year. So we saw this kind of carve out in the COVID-19 quarantine leave law with employees of 10 or fewer employees, and this net income language, that's where I think this first came from. Now they're using it for the paid sick leave that's going to apply forever. So if you have fewer than 5 and a low net income, you don't have to give paid sick leave. You can give unpaid sick leave. But you still have to give it. You can't penalize somebody for using their 40 hours of sick time, even if it's unpaid. Now, so that's very similar to New York City. How do we get different from New York City? This second bullet point. Employers with 100 or more employees, so what we will just call large employers as far as this guidance or this law is concerned, 56 hours, or some of us might call 7 days of paid sick leave. Hours is always easier to track than days because people work different hours and different days. We know that. But 56 hours, if we call it 7 days, that's a big ask. That's very different from what New York City is. That's a benefit beyond what New York City provides. So we're not identical to New York City statewide. And this is going to now give more benefits to those of you that have operations in New York City. You're not going to be able to comply with both if you ignore the 7 days, the 56 hours. So you got to look to both now on a statewide basis. Your head count is determined based on your calendar year, defined as a 12-month period from January 1 to December 31. But the other items, accruals, usage, that's going to be up to how you determine a 12-month period. Whatever you use. Most often it's going to be January 1 to December 31, but I'm sure there's some employers that can give me a good reason why there should be different. Usage and accrual, sick leave will accrue at the rate of 1 hour for every 30 hours. This is New York City-esque. That's the same standard that New York City has. There is the option to front load the sick time, which means you don't do it as an accrual, so you don't have to track it. problem with front time, problem with front loading. You can sometimes face abuse of usage. Employees can take all 6 or 7 days, 5, 6, 7 days, whatever it is, based on your size, by February, and then quit by March, and then you're stuck holding the bag. That doesn't happen if you go with an accrual method. The downside to an accrual method, it is harder to track, but if you work with your payroll company, perhaps you can figure out a way to track it. It's obviously a little bit more difficult for exempts where you don't track your hours necessarily, but non-exempts, it's not hard to track it. It's just a little bit more of an administrative ask. You can set a reasonable minimum increment for usage, which cannot exceed 4 hours. That's the amount of time that somebody can use. So you can't say, oh, in order to use sick leave, you got to use at least a 6-hour increment. That's unlawful. Okay, it cannot exceed 4 hours. Sick leave usages, reasons. It can be upon an oral or written request. So oral is always, I'm sure you can imagine, scary because we don't have good documentation. It doesn't prevent you from documenting it internally, but you can. There's nothing right now in the way the law is written that prevents an employee from giving an oral request. Again, you should document it, but that's good enough for the employee to use. Now, you'll see what it covers. It's going to cover a lot. Mental or physical illness, injury, health condition. I mean, a lot of this looks similar to what for those of you that are under the FMLA, a serious health condition. This is going, I presume this is going to be interpreted broadly, and it's going to allow employees to use sick leave for a lot of things. Diagnosis, care, treatment of a mental or physical illness, injury, health condition. We don't have definitions for those things for, what's a physical illness, what's a mental injury, what's a health condition. We don't have those answers yet. I presume they will come, but we don't have them yet. And then the last one you'll see at the bottom is about safe time, what we would call safe time in the industry. An employee's family member has been the victim of domestic violence, family offense, sexual offense, etc. All right, who is a family member? So I highlighted the one part that makes it somewhat different from what we all know as a family member under paid family leave. It's going to cover your spouse, your domestic partner, your grandparent, your grandchild, your child, I think I said spouse already, your parent. The one thing that is different from paid family leave, your sibling. Sibling was originally in the guidance for paid family leave, and they pulled it out, or the law, I should say, they pulled it out. It is back in for New York State paid sick leave. It is not part of paid family leave. Do not confuse the two, but the way the law is written right now, sibling is covered for a family member under the New York State paid sick leave. Carryover, and I know we're going to run a couple of minutes over, but I do want to get through this because I think it's valuable, so just bear with me. Carryover and payout. Unused sick leave must be carried over to the next calendar year. So that's important. There's a carryover requirement. There's not enough in the way of guidance yet on whether or not you can pay people off, so you don't have the carryover and you can buy them out. New York City, you can pay them out, but you got to then front load it again. So that way the employee has sick time to use in January and February before they might have time to accrue it. That's New York City. We don't have that guidance yet from New York State. I anticipate it will come, but be mindful that there is a carryover requirement. So it's not a use it or lose it the way the law is written right now. There's no requirement to pay it at the separation of employment. What I will urge there, right now there is no requirement to have a written policy. You can bet your bottom dollar, whoever you deal with, whether it's one of my colleagues over in the Long Island office, in the city office, or a different law firm, you are strongly going to be recommended to have a sick leave policy, and it's going to specifically spell out separation of employment is not, these benefits are not payable at separation. The law allows it. We'll make sure that's spelled out in a policy. The sick leave pay, for all intents and purposes, you're going to be paying it at the regular daily rate of pay. There's going to be always some exceptions depending on how certain people are paid. We're not going to dive into that, but assume you're paying them the regular wages for the day that they're out sick. How does this impact your existing policy? I can summarize the first bullet point very easily. If you have a policy that provides these benefits or greater benefits, and that could be a PTO policy, that's fine, and you will comply with this law as long as your reasons for usage are the same and you give at least the same amount of time. That's the key. So what you can't do is deny somebody leave under your PTO policy for a reason that's covered here, even if you give them 20 sick days under your policy, which is more than enough time, but you got to allow them to use it for the same reasons. So you might have to update your policy to include all the reasons spelled out in this law. You might also have to update your policy to give more time based on how much time you currently give. Or maybe, and if you don't do a PTO bucket and you do a vacation, personal, sick, you individualize each benefit, you can still do that, but then we gotta hyperanalyze your sick policy to make sure it complies with this. If you have a CBA, there's a CBA carve out as there is in most of these laws. The CBA must specifically acknowledge the provisions of the new law, though. So if you have a labor relations arm of your business and you have a contract and you deal with the union, this is going to become something similar to PFL, where the contracts are going to have to at least account for it, and how it's handled from there will be between you and the union that you work with. So a couple of other weird caveats. There's a requirement in the law that the employer must give a written summary of how much time has been used and how much time has been accrued by an employee if they request it. You'll see that 3 business days, and it's only upon the employee's oral or written request. To just do this to everybody, you have to do it when it's requested. You might get in the practice of doing it for everybody, and that's fine just to comply with this, but it doesn't really help you, because if you give it on January 1, say here's your accruals, and then on March 15th, somebody says, I need to know my up-to-date information. You have 3 business days to give them that information. The 3 business days tracks the same language in the paid family leave law, where you have 3 business days to complete the paperwork. The employer must maintain records regarding the amount of sick leave provided to employees for 6 years. Why is that important? Because this is an extension of this is an amendment to the New York labor law, which has a 6-year statute of limitations. So just for your record keeping requirements, you're going to want to save all this documentation about sick leave for 6 years. You cannot require disclosure of confidential information. We don't have any information yet on documentation requirements, not in the law, but you're not going to be allowed to start prying about confidential medical information. I will tell you, for those of you that don't deal with New York City, it is very lax on what you can actually ask for. There's not a lot. The employee, I should say, is given a lot of free rein to kind of tell you when he or she wants to use sick time, and then you just have to take it. So if that comes to New York State, it's going to possibly modify how all of us handle some of these disability or sick leave situations. So first bullet point on this final slide, this is a carve out for New York City. If they give more, again, it could be anywhere that has a population of 1 million, but if somebody gives more, of course, they're allowed to continue giving more than what the state law now is going to offer. There's anti-discrimination and retaliation provisions for requesting or using sick leave. I'm sure we all expected that. There's a right of job restoration for anybody who takes sick leave. I'm sure we all expected that. The guidance, public outreach, and regulations are all to follow. There's supposed to be a public outreach campaign that's going to give guidance. The Commissioner of Labor is going to be allowed to give regulations, which I assume we will probably see prior to the end of the year. I don't know if we'll see it prior to September, because remember, all this really starting in September is accrual, so maybe we get a little and then we get some revised guidance. Maybe there'll be a notice and comment period on the guidance. I don't know. I'm speculating, but we shall see. With that being said, I apologize for going a little bit over. I hope this was informative for everybody. Again, this is not something that you need to do tonight or tomorrow, but it's something that when you think you're out of the woods and COVID is over and there's nothing else to deal with that, this is something that should be near the top of your list, because it's going to affect you. You're going to have your policies looked at. If you just had your handbook revised in January, you might have to have it revised again, or at least these policies. And again, I also want to, I'll throw on my last shot for the Suffolk County Ban the Box. If you have operations in Suffolk, let's get a look at your applications. Let's get a look at your job postings. Let's make sure we speak with our interviewers and anybody doing phone calls or anything, and make sure they know what's allowed to be asked and what's not allowed to be asked. So I think times are changing. With that being said, I truly hope everybody out there and their families are safe and healthy. Please try to enjoy your weekend. Spring is, I guess technically spring is here. Before you know it, it's going to be May and June. It'll be beautiful out. We'll have sports back. We'll hopefully have some semblance of life back, and we will get back into, at this point, I need to figure out a way to lose enough weight to fit back into my clothes so I can go back into the office, because basketball shorts are not workplace appropriate. So that being said, I hope everybody has a wonderful weekend. Please stay healthy. If you have any questions on any of this, my information is on the cover slide. If you need a copy of the presentation or anything like that, just you can reach out to us in the normal course. So please take care. Have a wonderful weekend, and speak to everybody next month. Bye-bye.